Let's talk about hands-on manual techniques that you can do either on yourself or have a family member, a loved one, or a partner do on you to help reduce pain, reduce tension, muscle guarding, spasms, etc., to continue to propel you forward along your pelvic health journey. So one common thing that we often see in the clinic is, especially with pelvic pain with intimacy, sometimes, oftentimes actually, with urinary symptoms, whether that is bladder leakage or that is bladder pain, urgency, frequency, etc., constipation. There are so many different symptoms that arise from just a lot of overactivity and tension that just simply means that the muscles are holding on, they're contracted, they don't really know how to let go and relax. And these painful symptoms, or just aggravating and annoying symptoms, can often come after all of this has taken place. So hands-on manual therapy can be a great tool that you can do on yourself or have a loved one or a partner do for you that can really significantly make a huge difference in how you feel and impact your quality of life for the better. So let's talk about how to do that. There are a couple strategies I like to cover. I'm going to start right here at the pelvis and the abdominal wall. So if you think, I'll use my model here. So here is a pelvic model. This little part where my two fingers are right here references the pubic bone. You have the pubic symphysis right in the middle. You have the right side of the pubis, the left side of the pubis, and together they form to make the pubic bone. Here's the sides. We have our iliac crests, which make the sides of the bowl of the pelvis. So the iliac crests are what I can kind of stick my hands on, those bones right here that I can put my hands on each side. Those are the iliac crests. And then in the back, we have our spine. This is our lumbar spine. So a couple of different ways that we can really help reduce tension, muscle guarding, and through the pelvis is by just hands-on release. And so what I like to think about is if there is any type of pain, guarding, tension being held in this area, I like to think of just gentle swooping motions around the areas that are tense and tight. There are a couple of different strategies for this. You can start really, really lightly. You can just kind of glaze over the skin. You can go a little bit deeper. Excuse me. One way I really like to get into the pelvis and to help release the muscles around the pelvis is to think about where the hip flexors are, the muscles that help support the spine, the hips, the pelvis, obviously. And so I really like to come in here, kind of put my hands, a little bit of pressure, and then gently swoop along, following the insides of those iliac crests. I'm doing that on both sides, or doing it on the side, obviously, that you know you need because of the increased pain or tension there. Now, just a little note, this should never, ever, ever increase your pain. You shouldn't feel like this is exacerbating your symptoms. It should be very relaxing. A little bit of a dull ache is one thing, but any type of sharp, excruciating, lightning bolt type pain, shearing, anything that is obviously very intense is not what we are aiming for at all. So the same concepts go along for glute muscles, for back muscles and through here, quads, hamstrings, inner thigh muscles. All of these muscles, they have fascia, which is connective tissue that runs up and down, envelops all the muscles and organs in our body, but specifically with our musculoskeletal system, these muscles cross and they travel and they influence the pelvis itself, ultimately the pelvic floor. So we want to make sure that the surrounding muscles around our whole core and pelvic floor are working well and are working and functioning optimally. Another really great tool I like to use are these silicone massage cups. You can see that it is squishy. This particular cup I have here, it has some nice give, and I really like this size because it's a great handheld size. It's not too small, but it's also not too large. And what you want to do, I usually use coconut oil, and typically most people really enjoy coconut oil, but it doesn't have to be. It can be olive oil, it could be grapeseed oil. It could be your favorite lotion, cream, anything that just has some good slip and won't dry up real quickly or pile up or pill up, however you pronounce that, underneath your fingers. You want it to have some nice slip. So oil typically works really well. And what you're gonna do is I'm gonna lift my shirt a little bit here and lower my pants down. You take this with a little bit of oil, you squeeze it so it suctions onto the skin. It's not gonna work now because I don't have oil on my skin, but you would essentially glide this up and down across your skin. And so the more you suction, the more of a lift and the more decompression you are going to get through that area, but you can be really, really gentle. And so great ways you can do this are in through the pelvis, in around the mons pubis, covering this whole low abdomen area, or surrounding the bladder. Obviously, we know the uterus sits behind the bladder, etc. So we can really get some good fascial decompression in through there. You can do the other side. This is a great one for glutes as well, for inner thighs, a little bit of quads or hamstrings, back muscles as well. So this is a great way that you can do this. One of the other strategies I want to talk about is skin rolling. So for skin rolling, I'm going to turn a little bit here. You want to pinch the skin a little bit, and then you're going to roll it up or roll it down with your fingers. And so this takes a little bit of practice, but what you can see is I'm picking up a little bit of skin, and then I'm using my fingers to roll that little piece of skin upwards or downwards. You can also do it across, which across I think is a little bit trickier, but you can see I'm kind of getting it there as well. And this is another really good way to allow a little bit of a lift, a little bit of decompression, get these fascial structures and the connective tissue moving really well alongside each other. This is also great if you have a cesarean scar or any type of abdominal scarring. This is excellent for that as well. So those are some of our favorite strategies. Let us know if you have any questions, and we'll see you in the next video.